Hi everyone, today we'll be discussing medications for cirrhosis. So we're just going to do a background on what cirrhosis is. It is the scarring of the liver from long-term liver damage. The formal definition is the liver once having normal tissue has been replaced with non-living scar tissue. Cirrhosis is commonly caused by patients who binge drink for many years, which is alcoholic cirrhosis. It was an interesting fact to note that not all alcoholics have cirrhosis. It is also seen in those with non-alcoholic fatty liver disease, and that is the buildup of excess fat causing inflammation of the liver and causing liver cell damage. This is mostly seen in obese and diabetic patients. And cirrhosis can also occur in those who are affected with chronic hepatitis B or C. Both hepatitis causes liver inflammation and damage. Behavior modification is advised first depending on the underlying cause and severity, such as prescribing a healthy diet and exercise for non-alcoholic fatty liver disease, or advising to stop the use of alcohol for alcoholic cirrhosis. If we are using medication for treatment, we could categorize cirrhosis in two types: compensated and decompensated cirrhosis. Compensated cirrhosis is when liver disease is early on and we are able to treat and maybe even reverse cirrhosis. So if the abstinence from alcohol is unable to be sustained, then medication could assist with the maintenance. Or if the person is experiencing hepatitis-induced cirrhosis, then we would want to use antivirals to treat the hepatitis. If left untreated and the cirrhosis progresses, then this would be considered decompensated cirrhosis. Then we would want to start treating the complications of cirrhosis, such as with non-selective beta blockers, diuretics, lactulose, and antibiotics. And we will be getting into what these medications do for the liver. But if cirrhosis is far too severe, the medication would not be prescribed because medication is filtered through the liver and medication may not be tolerated. So in this case, transplant may be recommended. We will be focusing on the medication taken for decompensated cirrhosis. One medication that could be prescribed are beta blockers. They decrease blood pressure, slow heart rate, relaxes blood vessels, and improves electrical signal. Cirrhosis's most common complication is portal hypertension. So what does that have to do with the heart? So let's think back to anatomy and physiology. The portal vein filters or cleanses the blood from the GI tract, and then the blood returns to the heart to be oxygenated. Since the liver is diseased, the blood is having a harder time being filtered, causing a backflow, and the blood trying to enter the liver causes an increased pressure in the portal venous system. It is common for people who have decompensated cirrhosis to experience esophageal varices, which is an enlarged or swollen vein and may burst from the pressure. And if they do burst and it is undetected, a person may go into shock or become unconscious. Beta blockers decrease blood pressure, which will decrease the amount of blood going to the liver and allowing the liver to essentially catch up and reduce the pressure in the portal vein. A common beta blocker is propranolol, sold as Inderal LA. And this is sold over the counter. It could be sold as a solution, injection, tablet, or capsule. And another common beta blocker is Nadolol, and that could be sold as Corgard. It's a prescription drug, and it's in tablet form, taken once a day. Some side effects can include numbness or cold feeling hands or feet, vision problems, or memory problems. Other complications of decompensated cirrhosis from portal hypertension can include ascites, which is fluid in the abdomen, and or peripheral edema. Cirrhosis can trigger the kidney to retain sodium and water due to the high pressure from portal hypertension and a disruption of the liver functioning. To treat the buildup of fluid wherever it may be, it is advised to reduce salt intake to a 2-gram sodium diet. If behavioral modification does not occur or if there's too much fluid, then diuretics would be recommended. A common diuretic regimen is spironolactone, which is sold as Carospir, with frusemide, sold as APO frusemide. Carospir is a prescribed drug that can come in a solution or tablet. The patient would start out with a 100 milligram regimen, and it can increase dosage to 400 milligram, dependent on the rate of the alleviated symptoms. It should be taken once or twice a day with food. We want to limit weight loss to 0.5 kilograms with those who do not have peripheral edema, or 1 kilogram for those who do. Apofrutamide is a prescribed drug that comes in a tablet form. It is advised to take these medications while on a low-sodium diet. With the liver not functioning properly, there's a buildup of ammonia, which is a toxic waste product produced in the body. A functioning liver cleanses the ammonia so it does not cause the body any harm. But without the liver cleansing or essentially disarming the ammonia or excreting it, it can create harmful effects, especially to the brain like confusion, low energy, and can even cause a person to go into a coma. This is known as hepatic encephalopathy. Lactulose, an orally taken laxative, has an acidic effect by trapping the ammonia and resists it from being absorbed into the body through excretion. Lactulose can reduce ammonia by 20 to 50%. Lactulose is commonly sold as Enulose, which is an over-the-counter drug or a prescribed laxative. Results are typically slow but could be used for long-term use. This is used for constipation and binding the ammonia to be excreted. An antibiotic may be prescribed to decrease a reoccurrence of hepatic encephalopathy by decreasing the overgrowth of bacteria colonies that produce ammonia, while decreasing the risk of any other infections, since those who have cirrhosis are more at risk for infection. In a double-blind randomized trial in 2013, it showed that rifaximin, which is the antibiotic typically prescribed, while taking lactulose, is more effective than taking lactulose alone. So the dynamic duo includes the lactulose, who reduces the absorption of ammonia, while rifaximin reduces the bacterial growth and contributes to the restoration of the microflora balance. So the study has shown that it also decreases the risk of sepsis-related death in those with cirrhosis. And sepsis is an infection that can cause tissue damage, organ failure, and death. So that's one infection that is the risk being reduced. So rifaximin is sold as Exvaxin, which comes in tablet form and is taken every 12 hours, and it is a prescribed drug. Side effects may include swelling in the hands, feet, and in the midsection. Thank you so much for watching my presentation about medication for cirrhosis.